On Wednesday of this week, something really dramatic happened, something that we haven't seen for over a decade. No, it wasn't the release of the new Taylor Swift album. It was an inverse in the 10-year and 2-year yield curves. Now, don't turn off the video. I'm not going to go into an incredibly boring explanation on what yield curves are. But I want you to understand what this indicates. This inversion of the 10-year and 2-year yield curve has predicted each of the last 7 recessions. The last time we saw this happen was in 2007, right before the housing crash and the market crash of '08. So it's important to understand that this may be an indicator for an upcoming recession. Now, usually I talk about healthcare, and I'm going to talk about healthcare in this video as well. Healthcare didn't cause this. There are a lot of factors, the trade war, what's going on in Germany, etc. But healthcare could be dramatically impacted by it. So let's take a look at what happened the last time this curve inversed. If we look at the difference between '07 and '09 from a federal budget perspective, we see that a number of things happened over those 2 years. Between 2007 and 2009, federal revenue, tax revenue, went down by 18%. Federal expenses went up by 30%. The deficit went up by over 800%. And healthcare spending went from 22% of federal revenue at the federal level to 32% of federal revenue. Our debt as a percentage of GDP, our total debt as a percentage of what our total economy is, went from 62% to 82%. We spent on our credit cards a little bit. Now, let's fast forward. Let's say that this inversion of the yield curves is predicting another recession. Let's say it's going to happen in the next year. And let's for a moment say, well, what if it's as bad as what happened in '08? Similar percentages. Revenue goes down by 18%, expenses up by 30%, etc. Well, this is what it looks like now. Federal spending would now go to 190% of revenue. That means that we'd be spending 90% more than the revenue we take in. Think about that from a personal perspective. That'd be like saying if your income is $200,000, your spending is almost $400,000 a year. The deficit in 1 year would go to $2.5 trillion. Now, in 2007, just a decade ago, $2.5 trillion was the entire federal tax revenue. That would be our deficit now. Healthcare would go to 47% of federal revenue. Almost half of every dollar that the federal government brought in would get paid out for federal healthcare spending. Medicare, Medicaid, the subsidies on the ACA, and the federal government as an employer. Our debt would go to 125% of GDP, twice the level that it was just a decade ago. How does this impact healthcare? What does this mean? Well, the big question is, if that happens and we have a new president or a re-elected president, what are they going to do? What are they going to do about an economy that starts to tank and a federal budget that starts to look more like Greece? Well, they might reach for a very quick lever, maybe the wrong lever. Maybe this means Medicare for all. Maybe this means universal health care. Maybe this means cutting health care benefits dramatically. I don't know what it means, but if you're running a problem area, if you're running a federal budget that is way out of control and half of your revenue is being spent on one area, and it's an area that people are complaining about, you may look for an easy, quick solution. It may not be the right solution, but it may be an easy and quick one. And the point of it is, if one of these solutions happens or one of these levers happens, it could be incredibly bad for doctors and hospitals and those of us that have to go see those individuals for care. So, on that bright and shiny note, I'm going to go off to my weekend and find a bottle of scotch somewhere and pretend that I didn't know any of this stuff. Hope you can do something like that too. Thank you.